Welcome back into Crosstalk here on this Friday morning edition of the program. We're kicking off a new series here with Davita. Davita, of course, taking over the operations of the dialysis center here in Sterling, and we've had an opportunity to talk with them about their facility and are beginning a monthly conversation with them about a variety of healthcare topics. And I'm joined this month by Ben Cornell. He's the Regional Operations Director. Ben, thank you for being a part of the program and for being a part of this new series.
Glad to be here.
This month, we're going to kick things off and talk about integrated healthcare. Now, I hear integrated healthcare. We hear a lot of healthcare terms on the news, especially here recently when we were dealing with the quote-unquote Obamacare stuff, but we don't really know what a lot of it means. So I guess we first have to start with, what is integrated healthcare?
Integrated healthcare is really about thinking through the whole patient experience from beginning to end. And also, as a patient ages over time, how are we delivering the right health care when they need it and in the most efficient way? And the way integrated healthcare has kind of come onto the scene, it means many different things to many different people. But at its core is really looking at that whole patient and how are all care providers delivering the right care to that person.
And all care providers, that doesn't cover just what you guys do or just what a hospital does. This is the entire spectrum of healthcare, correct?
Absolutely. And, you know, the idea that we could treat people in silos, over the last 30 years, there's been a lot of specialization in medicine. But in some ways, this is a little bit of back to the future. In the 1940s and 50s, you'd see one doctor for the vast majority of your needs. And now you may not be seeing one physician, but you do have somebody there that's helping to coordinate all of your care, who sees the big picture and understands what you, the patient, need. And that, I think, is a really exciting thing about integrated healthcare.
Well, and that's one thing that has fascinated me. Here recently, my wife had an episode where we were unsure of what exactly the health-related problem was. So we've seen a variety of specialists, and it just absolutely fascinated me how every doctor's office, every specialist office that we went into, regardless of where we were, had the ability to access everything that was within her healthcare file. That is something that really takes quite a bit of technology, right?
Absolutely. And when you look at the future of healthcare, it's not just about the physicians or not just about the nurses. It's really about technology specialists that are helping the data talk to data systems from other sources. It's also about people who can interpret the data and help identify maybe there's a specialist over here that sees one symptom and a specialist over there that sees a different symptom. And by connecting those, you might find out what the bigger issue or problem is. So, I think people need to understand that healthcare is no longer about you sitting down with that one person in that room. It's about your full life history of medical history and how we can use that to better treat you today and in the future.
We're talking integrated healthcare this morning with Ben Cornell from Davita. And, Ben, when I hear that, I can automatically hear an older generation saying it was a simpler time when the same person could help me with everything. Obviously, there's some frustration in the integration model. So when you're integrating into something like integrated healthcare, you've really got to look at some people that are leaders, I guess, in creating the integrated healthcare system. Who are some of those leading models right now?
Yeah, so there's a couple different models, and hopefully your listeners are pleased by some of these because different people want different things. Mm-hmm. First, there's a closed model system where you get all of your health care from one provider. Kaiser Permanente would be an example of that. So when you want to see your primary care physician, you want to see a specialist, they're all within the Kaiser Permanente network. Then there's open systems, which maybe it's the Cigna network or the Aetna network, which is a broader insurance platform. But basically, you're seeing people who can see a lot of that data. They're sharing that data back and forth, but you have a lot of choice about who you go to. That's one element of it. But the other element is who is kind of overseeing your care. And there's actually, right now, a really exciting thing going on in healthcare, which is two separate models. One model is called the patient-centered medical home, and the other model is called accountable care organization. And at the root, it's who is your quarterback. And at the patient-centered medical home, your primary care physician is your quarterback.
Okay.
They're the one who's understanding your full needs. They're making sure they're talking to your specialist. And accountable care organization, it's usually the hospital system. It is, a central administrator who is making sure that you're getting all of the right care that you need. So your listeners may find that they actually are interacting with one person if it's the patient in the medical home, or they might be interacting with a management person, a specialist in the accountable care organization. It's really hard to say which one's going to win out or if both will last, but healthcare is changing, and integrated care is the way it's going.
And there's no question about that. Now, I can see this being a relatively easy thing to integrate in a bigger community, in the Denvers and the Greeleys and the Cheyenne, Wyomings, the bigger communities. When you get to a community like Sterling, how's this going to play out with something like this? Because you don't have the choice, I guess, if you will, of the 50 people that specialize in heart care of people ages 5 to 15 or whatever the case may be, like you would have in a community the size of Denver.
Mm-hmm. Well, this is where I think integrated care is actually at its best. In a community like Sterling, instead of waiting until your condition gets bad enough that you need to go to a specialist somewhere else, the hospitals and the healthcare professionals will have a big incentive to give you great preventative care. And that means more visits to your primary care physician. If you feel like you're not feeling well, they're going to be more accessible to you. There's going to be phone numbers that you can call if you just need some advice. And, I can tell you, Ben, as a new parent, I have a 6-month-old at home. I'm calling for advice almost every single day. So this is one of those things that in a place like Sterling, you're going to actually see better care for your small aches and pains and your early sickness, rather than people coming in at the last minute when you've got pneumonia or you've got something more serious. So I actually think it's going to be a great thing for everyone here in Sterling.
We are having our final Friday of the month talking healthcare with Ben Cornell. He's the Regional Operation Director for Davita, and we're talking integrated healthcare now. I'm going to go offline here just a little bit, but it all plays into this system as well. When you talk about care, healthcare, every time I open my bill, I probably need some healthcare after getting the bill there. So you're talking about the future of the medical system from not only a service standpoint, which we've talked about here as well, but the cost standpoint. Couldn't this get relatively costly?
Absolutely, and I think that's what we're seeing is healthcare is just becoming so costly, and because we have a large number of people that are retiring and their health needs are greater, we're seeing our nation being burdened by a gigantic health bill, just like you see in that bill every time you go to the doctor. So what I can say is if you're seeing primary care physicians and you're getting treatment early for those symptoms that you feel, it's a lot more cost-effective, and you're going to feel better. You're not going to be going to the hospital, so you're going to win. The physician and the hospital system, they're not going to have those major medical costs, and in a place like Sterling, they're not going to have to invest as much to have the latest technology because most of that is low-cost interventions. And then from a government or a payer standpoint, it's a lot cheaper as well. So I can tell you, if we were all seeing the doctor regularly, we could actually avoid 20 to 30% of those high-expensive hospital visits, and that really makes all the difference.
It's finding that right balance between being a hypochondriac and being tough enough.
Well, I'm telling you, with a 6-month-old, I'm right there with the hypochondriac, so I can empathize.
Absolutely, no question about that. Now, I guess on the medical system, we talk a little bit on the cost end. What impact is the integrated healthcare system going to have on, say, creating healthcare jobs?
Well, in a place like Sterling, I think there's going to be a lot more in terms of coordination of care jobs. And so many of those jobs don't require a nursing background or don't require a medical background at all. It's more about how do you manage different people, how do you manage information, How do you make sure people are communicating with each other? And, your experience, Ben, that you mentioned earlier in the interview around everyone being able to see all of the information, that's not true for everyone. And somebody worked hard to make sure that that information was being shared appropriately. So it's for many of us who never thought we would be in the medical field, and I'm one of them, it's now opening up new possibilities for us to have a job that really helps people, makes a positive impact, and takes us to the future of healthcare.
Is this also going to change the educational training for healthcare because it is so, I don't want to say drastically different, but it is different than the previous model of healthcare?
Absolutely. It will change dramatically. And, I think one thing at Davita that we work hard on is for our current teammates who are experts in what they do, we're educating them on what's new and how to be better care coordinators and make the right calls to the right specialists, to the right transportation company, to the right insurance company, because the medical world has gotten a lot more complicated. But I can tell you the younger generation being able to use social media like Facebook and Twitter, or being able to look up information on the internet, or communicating with their friends, at all times of day through all modalities, that is actually where a lot of this is going. And I can tell you I went to a really innovative primary care clinic, and many of the patients, they'll just take a picture with their cell phone. Maybe they got a cut on their leg. They take a picture of it. They text message the photo to their physician, and then their physician can tell them, go to this place to get stitches, or you should be fine, put some ice on it and stay at home. That's the future of medicine.
It's just absolutely fascinating to think. I'm only 30 years old, and to think about where it was when I was 5 and 6 years old, when I fall down and scrape my knee, or when I broke my arm back when I was in 6th grade. The difference between where healthcare is to healthcare now, and for somebody like you who never thought you'd be in healthcare, it's just fascinating the way everything has changed and where it's going to go. I mean, who knows 10 years from now what it will look like?
Yeah, and the main thing is folks should really embrace that change, because it's all about giving patients great service. And really, for a long time, our medical system has catered to what the medical system wanted. And now we're changing, and it's going to what do patients need, what do patients want, and how can we deliver that in a cost-effective way. It's a great time. It's an exciting time. Sometimes it can be scary, but I think in the end it will be better for all patients.
Absolutely. Ben Cornell, the Regional Operations Director for Davita, our guest. We're going to be doing this on a monthly basis, talking about a wide variety of healthcare topics. And Ben, I really appreciate your time. It's been very informative today about integrated healthcare.
I'm excited to do the show, and thanks, Ben, for all your great questions.